Welcome back. South Africa is critically under-resourced to deal with the mental health challenges, and that is according to mental health experts. The concerns come as South Africa observes Mental Illness Awareness Month. According to the 2022 Mental State of the World report, South Africa recorded one of the lowest scores in the mental health globally. The report surveyed over 200,000 people from around the globe, with around 12,000 people from South Africa. Experts say the current difficult economic climate and work stress are some of the greatest challenges people are facing. The current economic conditions, people are worried about losing their jobs, and companies employ less people, which means the workload increases. Experts say the situation creates cultures whereby individuals are struggling to cope at work. And now for more on this matter, we're now joined by Dr Gagu Matsebula. He is one of the members from the South African Society of Psychiatrists on mental health, and he will talk to us about the current economic climate and how it affects mental health of people around the country. And he joins us via Zoom link. Dr. Gagu, thank you so much for joining us here on the Late Edition. Firstly, let's start here. Of course, we are indeed observing a Mental Health Awareness Week in the country. Why is it so important for us to pause and observe, the state of mental health in the country?
Thank you for having me. Good evening, Mbali. It's absolutely important that we do take time to look at mental health and to put it in the spotlight. And that is because mental health is so important for a human being. It allows a human being to be able to participate in society. It allows a human being to be able to tolerate the stresses that come at them. This could be on the work front, it could be from school. Mental health also allows a human being to be able to live, a fulfilling life. It's an absolutely essential part of general health. And it's very important that from time to time we remind ourselves how important our mental health is.
And of course, while we look at mental health, at the same time, we are facing, a very shrinking economy in the country. What would you say is the state of the economy plays an impact? What sort of impact it plays on, the mental state of people in the country? Well,
what you've just spoken about is one of many stressors which are weighing extremely heavy on people's minds. It's the economy, it is job safety, it is job security for those that do have jobs. And for those that are not employed, it is, the constant threat that jobs might not be readily available for them. And not only that, if the economy is not growing well, then by extension, the state is not able to provide those very important requirements for the populace, like health, for an example. And so if the populace is aware that if, say, for example, they go to their local clinic or they go to see their family doctor, and because of resource shortages, whether it's human resource shortages or shortages of the required material there, then there's a possibility that that individual might not get the help that they need. And by extension, the populace might not be able to live to their fullest potential of their being. So yes, when we talk about stressors, we talk about multiple things, including the state of the economy of the country.
And, have you seen an increase, especially when dealing with financial problems? Because one would say that we've seen the interest rates, we've seen the cost of living in this country, we've seen a number of people lose their homes, some losing their cars. Would you say that when a number of people are coming to the fore and expressing their problems of mental health and stress, that the financial problems seem to be increasing in the country?
Yes, quite right. The South African Depression and Anxiety Group has just recently released their statistics, and they've spoken about how if they compare the number of phone calls that they're getting after the COVID pandemic, there's been a 400% increase in those phone calls. And financial stressors are definitely one of the reasons that push an individual to start to develop severe stress and by extension to develop depression and anxiety. The life insurers of this country as well have also been releasing their statistics, and those show that unfortunately, because of depression, because of anxiety, because of mental illness, there is this significant rise in people that need to be booked off work, and there's a rise in people that do need to claim income protection from those life insurers. So yes, the overall picture that we are seeing as mental health care workers is that there is this unfortunate increase in the number of people that are seeking help. But the good thing is people are seeking help, which means that there is this growing understanding and awareness by South Africans that they might be having these difficulties that lead them to develop mental illness. And they are aware that there are particular avenues that they can approach to get assistance.
And, what advice do you give to somebody who has reached out and says that, look, I'm depressed, I have anxiety, and most of it is indeed caused by the current economic climate in our country? How do you help and alleviate the pressure, to sort of ease the burdens that many people are going through so that they don't get depressed?
Thank you for that. So when it comes to how we assist a person that comes to us that is now developed depression, the model of therapy that we give is what's called biopsychosocial, and I'll quickly break that down for you. The first aspect is bio, that relates to biological, and there, if a person has got moderate to severe depression, then we do need to start giving that person some medication. Antidepressants are the medications that we tend to use. The second aspect of that, which is psycho, that speaks to psychological or psychotherapy. There we have psychologists and ourselves as psychiatrists and other mental health care workers. And we give what's called psychotherapy or talk therapy to the person. And using that, we try to assist them to change perhaps the way that they think about themselves, their environments, their futures, to get them to the point where they are thinking a bit healthier about whatever challenges that they're facing. And then the last aspect speaks to the social aspect. And this is where now, working with other members of the multidisciplinary team, we're trying to help the person to come up with practical ways of dealing with whatever stresses that they might have. It could be financial stresses like you've spoken about, and there with thinking with the patient, because as you well know, each person has got different circumstances. So we think with the person about how they can best optimize what they have at that point in time in their lives. And then lastly, one of the benefits that we see in people whom we treat with these measures that I've just spoken about is that the way they think about their problems and the way they problem solve, that also improves as well. So you find that the person is now able to think about alternative ways, say, for example, of alleviating that particular stress that they have in their life.
And just lastly, before I let you go, one would ask, how far have we come as a country in terms of recognizing that mental health is a very important aspect in our lives, that we need to take care of?
So we're not quite there yet, unfortunately, as per the stats that I quoted earlier on. And the one that you quoted in the lead up to this interview. But what is heartening is that there's now a growing awareness, thanks to platforms such as this one, where we're able to discuss such things frankly and openly. And that is starting to make a dent. Are we there yet? Not quite. More definitely can be done. But it's better to have a start like we're doing now. And it can only grow from strength to strength as long as we're able to attack the stigma, which unfortunately still prevents people from seeking assistance for their mental illness.
All right, Dr. Gagu, thank you so much for your time here on the Late Edition. That is Dr. Gagu Matsebula from the South African Society of Psychiatrists.